Good afternoon. I'm here today to show my abilities to do a head-to-toe assessment. I am here with my patient, Cassidy. A couple of pointers I wanted to point out is the room. Always make sure the patient, number one, is comfortable. Keep in mind of privacy. You want to make sure the patient is comfortable as far as privacy as well. No obstructions around, no unnecessary equipment in the room. You want to make sure you do have your equipment for your vital signs, as well as a towel or a blanket for underneath the legs during the abdominal checkup. Before entering, you want to, number one, do hand sanitizer and check the doctor's orders. So coming into, I also have clipboard, but no paper. It will be used to mark down anything that is necessary of findings, history, anything like that. So the first thing you want to do is introduce yourself to your patient. Hello, Cassidy.
Hi.
My name is Kelly. I am your student PSW today.
Okay.
I was told that you need to have a head-to-toe assessment.
Yes, for my job.
For your job? Perfect. I'm going to check her ID, and by doing so, I'm also going to check her mental status as well as her ability to understand her orientation. So can you state your full name, please?
Cassidy Sullivan.
And your date of birth.
March 28th, 1999.
Great. And can you tell me where you are at this time?
At NBCC.
All right. And do you know the time? Approximate time?
3:45.
Great. All right. So Cassidy, what we're going to do right now is start with your vital signs.
Okay.
Okay. So first, I'm going to start by taking the temperature. Pulling back the ear. And she has a normal range, 37.1. Back there. Next, I'm going to check blood pressure.
Okay.
Now, your baseline, do you know your baseline?
120.
120. So Cassidy knows her baseline. If she did not know her baseline, I would put the cuff on her and find her brachial artery, inflate the cuff, and once her brachial artery stops, I would know that that is her baseline. And then once we find the baseline, we would go 30 milligrams above that. I don't want to go in front of the camera, but I'm going to go 1 inch above, keeping it snug, approximately 2 fingers under. Right here. Turn it the other way. Blood pressure is good. 120/80, which is the normal range. 140/90, she would be in hypertension. 90/60, she would be hypotension. All right. Next, I would document that as well. Well, let me go to this side only so we can see here. Next, I want to check her pulse. And her respiration. Very good, thank you. So both her pulse and her respiration are right on target. Pulse 31 times 2, we're looking at 62 for the pulse. Her respirations were 17. Very good. All right, so I'm going to get you to stand up here, Cassidy. Okay. Now, the reason I'm asking, while I'm asking her, to stand up, I'm checking her balance, any issues with vertigo, any sorts of things like that. I'm also going to get her to walk over to the scale. If you could stand up, I'm going to both weigh you an inch. Oh, yes, take your shoes off, please. Okay, so that was 80, sorry. So I'm going to get you to turn around. This is a little awkward. I'm going to get you to stand up nice and straight. Okay. Go ahead and have a seat. Okay. Again, I'm checking for the way she is walking, if she's steady, which she is. And at this point, okay, we'll leave your shoes off as well. Now, she was 80 kilograms for her weight. Can I mark that down? And she was 173 for her height. Trying to remember what that's marked in. Centimeters. Thank you. 173 centimeters. So, Cassie, if you don't mind, I'm just going to get you. Oh, no, sorry. Before you lay down, we'll start the assessment.
Okay.
My apologies. So, do you have any allergies?
No.
Any history of any illnesses in your family, such as cancers, heart disease, anything like that? All right. And how is your diet? Your nutrition? Do you eat 3 meals a day?
Yes, I do.
Okay, lots of water.
Yes.
Good amount of vegetables, balance.
Yep.
That's good. All right. So I'm going to start with Cassidy's head. Work my way down. So for the head, you want to take a look at the hair. You want to see if there's any parasites, any dandruff, balding, alopecia, anything of that sort, dry. You also want to be able to palpate. You're checking for any dents, lumps, bumps, anything of that sort, any lesions. You want to see any redness. In this case here, Cassidy is very healthy. Her hair looks very nice. Now for the ears, going downwards. Oh, also, do you have any history of migraines, anything of that sort? None in the family as well? Okay, and for the ears, you're going to take a look inside. It's a good idea to use a pen light in this case. If you want to see further inside, you want to take a look, see if there's any earwax, any buildup, any redness, any lesions of any sort. You want to do that on both ears. And inside is very nice. History of any ear tubes?
No.
Hearing, you don't wear hearing aids?
No.
All right. Now, on the outside of the ear, you want to take a look again for lesions, any redness, dryness, eczema, anything unusual. And both are good. You want to take a look at the symmetry. Both are even to the face. All right. And now we work our way to the face. On the face, again, you want to check for the temperature. Use the back of your hand. Best way to do it. You want to check for lesions. You want to check the skin. Lesions, any moles that may be out of sorts. You want to check for redness, bruising, anything, swelling. You want to make sure the cheeks are symmetry. Eyebrows, the face overall. Can you smile, please? Good. So the smile, the reason for the smile, I want to see if anything's drooping. I want to make sure both cheeks are rising, as well as the lips, both corners are even. Right, face is good. Now I'm going to take a look at the eyes. And for the eyes, there's a few things you want to take a look at. First, you take a look at the eyelashes, or the eyelids, sorry. You want to make sure that they're moist and they're able to open and close properly. The eyelashes, you want to take a look, any crusting of anything, sorts of that, any drainage, dryness. You want to look at the edema to make sure there is no yellowing or no redness. You're also taking a look at any drainage problems, and you ask a little bit of history. Any glaucoma or
no?
None of that, nothing like that in your family? No. Do you wear glasses or contacts?
I wear glasses.
Glasses, all right. So next I'm going to take a look at the response of her eyes. Just take a look at the nose here. And she is say she's a 4. Okay. Can you look up for me? Down, good, side to side, and the other side. So her eyes seem fine, they're responsive, and good. All right, and now I'm going to take a look at her nose. I want to take a look at her symmetry of her nose. It's a little off tilted, a little bit. I see that it's off a little bit. Have you ever had a nose injury?
Yes, broke my nose as a child.
I see that. It's a little bit off. You don't have any problems with the nasal. I'm going to take a look inside.
Nope.
Okay, you look, see. You want to make sure the mucus is moist. Again, no lesions, no sores around the nose, anything of that sort. And next, you want to take a look at the mouth. Now, the mouth, we already started with the smile, but we want to see that the lips are pink, moist, which is very good. You want to take a look for any sores. Could be a sign, again, with the mouth and the lips, could be a sign of herpes virus 1, type 1. Can you open your mouth? Inside of the mouth, you want to take a look to see that the tongue is pink, gums are pink and moist, no canker sores, teeth are good, nice and white. Can you open wide? And just take down the throat. You're taking a look for the tonsils. See if they're swollen. You have your tonsils removed?
No.
Okay. Very good. Tongue is good. Mouth is good. Going down. So on the neck, I'm just palpating to check for anything swollen, any swollen glands. Feels good. Checking for lesions, bruising. Is your neck tender at all?
No.
No pain?
No.
Can you do a little range of motion for me? From side to side, front to back. Good. And could you swallow? Perfect. No issues there.
No.
Checking for that. Put the shoulders a bit. There we go. All right. So, hold on there. I'm going to go around the back.
Okay.
You're going to take a look to listen to your lungs.
Okay.
So now on the back for the back and the lungs, what you want to take a look at, number one, you want to see the back is symmetric, the symmetry. You want to make sure there's no curvature to the spine, no markings, no lesions, no bruising, no moles. Of course, moles, if you see anything that is uneven or discolored, multicolored, and that sort. Now for listening to the lungs, we would start by going to the bottom, listening for any sounds. What you're listening for is wheezing or any water on the lungs of that sort. So it could be a sign of pneumonia, but that's what you would normally do in that for that area. Okay, Cassidy?
Yes.
I'm going to get you to lay down for me. If you don't mind, your sneakers are out. Go ahead.
Yes.
Lay back. Okay. Now, what I want to do next is start with her chest. Have any history of surgeries in your family, Cassidy?
No.
Nothing at all? Okay.
Yes.
All right. So now I'm going to assess her chest area. What you want to take a look here for is you want to see for tenderness, any discoloration. Because she's female, I'm going to ask her, is there any breast cancer in your family?
No.
Any history of it at all?
No.
All right. And do you do self-examinations every month?
Yes.
Good. That's good. You want to make sure you keep doing that. All right. And do you have any leakage or anything in the breast area? No. Okay. And your menstrual cycle is regular?
Yes.
Okay. And I would check in this case here her apical pulse. It's mid-clavicle. Sorry if I got that incorrect, but it's mid-clavicle down to the 5th costal, which is just below her breast. I would listen for, in this case, I would listen for 1 minute to see if the pulse is strong. Now, in the neck area, sorry, I should mention as well, I would check her carotid arteries. I would do it one at a time. And again, I would check for 30 seconds. The reason we do it one at a time, of course, we don't want to cut the oxygen off. Oxygen supply off. All right, and the chest, we're going to be checking, of course, again, as I said, moles. We're checking for lesions, bruising of any type. I've asked her if they're tender, no pain in that area at all, okay? Good. Now we're going to move down to the abdomen. In the case of the abdomen, we are going to first start visually. We're going to again look at any bruising, any marking, any tender areas such as temperature, heat-wise, anything of that sort. We're going to check the umbilical area to make sure that there is no discharge, no extended umbilical cord, that would show that they have a hernia, possible hernia, anything of that sort. So everything looks good. So now what you want to do is start by oscillating. So we're going to start at the lower right of the patient and work clockwise from there. You want to hear sounds, usually a gurgling sound, within 5 to 25 seconds. Right. Good. And you want to move. Of course, if I wouldn't hear, I've heard it each quadrant. If I wouldn't hear anything, I would want to listen for up to 5 minutes. Please. Now, after the no tenderness or anything in this case, you're saying what was your last bowel movement? Yesterday. And how about voiding? Any issues with voiding? It's regular.
Yes.
Okay. So after I check the oscillation sounds, I'm going to check for palpating. So again, I'm going to just cup my hand. Any tenderness?
No.
No pain?
Nope.
And I'm going to go around clockwise. Nothing. You let me know if you feel anything. I would do that all the way around. This case, she's fine. And from the abdomen, I'm going to work my way down to the peri area. In this case here, for a female, we will check a few things. I would ask her if she's sexually active, if she has any possibility of a STI. I would also visually check if I believe there could be an STI infection. We're going to look for unusual odor, unusual discharge, redness, lesions, anything of that sort. We can check for hemorrhoids, and also, and again, and same in the anal area, you would check for any redness, any lesions of any sorts, such as that. All right. Now, also the pulse, we talked about the artery, the carotid artery, the apical, not sure, apical artery. And also we have the femoral that is right here. We have the radial pulse and the brachial pulse. Coming down, we have the popliteal, and we have the posterior pedia. And we have the middle of the toe, which is pedia as well, dorsal pedia, I believe. Not 100% sure there. Right. So now I've gone to this area. Now I'm going down to now we're going to the extremities. So in this case here, I want to start with the arms. I'm going to take a look again for any lesions, any redness, any bruising. I want to check her range of motion. You're fine to move the arm.
Yep.
Is that right? Can you move the other one as well for me? Just stretch out. Perfect. Can you lift above? Great. All right. I'm also checking for tenderness. Nothing doesn't hurt at all.
No.
Okay. I'm pitting just to see what the edema is. She's very good. Nice, tender. your hands, doing a skin turgo. Okay, looking between the fingers. Take a look at the fingernails, see for any infection, any discoloration, doing cap refill. Good. In 3 seconds. Perfect. All right, now I want to take a look at both arms. And again, I'm going to do the same on the other side. The railing is up, so we're just going to slide over. So again, I know her range of motion is good, so I'm just checking, palpating. No redness, no bruising. Good. In her hand, cap refill. You want to do both sides. Turtle. Also another blanch test. Or pitting test, sorry. Oh, and the symmetry is good. I'd like to take a look at the shoulders. Make sure the shoulder's good. Now moving down to the legs. It's the same idea with the legs. You want to look again for any redness, any bruising, any edema. I'm going to do a pitting test. Good. Range of motion. Can you lift your knees? Good. And the other knee. Good. Thank you. Now her feet. You want to take a look at the feet. I'm just going to slip your stockings off real quick. I don't mind feet. So for the feet, you want to do the same thing. You want to check for bruising, redness. You want to check the toes for any infections, possible athlete's foot, anything like that. You want to check between the toes. You can actually check the pulse here on the side. Posterior pedia. You want the same ideal, 30 seconds time too. You can also check the one here in the back, between the toes. Put your stopper back on for you, in case your feet are cold. I just realized too that when I was checking the abdomen, I forgot to put the towel underneath. You would normally take the towel and put it underneath the knees to lift the abdomen, because you want to be able to see if the abdomen is normal, such as round and flat. You want to see if there's any extension or anything of that sort. I'm sorry, I did forget about that. Now coming down to the feet, you want to check. We did a little range of motion, but I want to see the strength of the feet. I also want to see the symmetry of the legs. Can you push forward and feet, please? Perfect, nice and strong. Do the same thing, push back. Good, good, nice strength there as well. Now I also realized that I forgot one thing as far as her arms go. Go down here. I'm just going to get you to turn this way. Okay. I'm going to get you to cross your arms. Oh, it's my apologies. I'm going to cross my arms. Take my 2 fingers and squeeze as hard as you can. Okay. Perfect. Good strength there. All right. So that is it. Thank you. What you've done. All right, Cassidy. I'll get you to put your shoes on. Okay. Did you have any questions?
No.
Nothing? No. Okay. All right. Thank you very much.
Thank you.
And cut.